is Sandra, Flores, and I will be doing your head-to-toe assessment. Okay. Can you tell me what your name is?
My name is Victoria.
Hi, Victoria. I'm going to go ahead and ask you to get in a gown. Okay. I'm going to go ahead and wash my hands. Once you're in a gown, we're going to go ahead and start your assessment. Okay. Prior to coming into the examining room, we went ahead and checked your vital signs. We checked your height and weight, and we checked your visual acuity, okay? And I'm happy to tell you have 20/20 vision. So now that you're in a gown, okay, I'm going to go ahead and start my assessment. Is that okay with you?
Yes.
Okay. I'm going to start by inspecting your head. Okay, I'm looking for symmetry. Make sure your head is all equal. Okay, we don't have any abnormalities. Okay, we look in the front, in the back of your head. We look for any lesions, any trauma. Okay, now my hands are nice and warm. I'm going to go ahead and palpate your head. Okay, so I'm going to start at the top, and it's really movable. Okay, I don't feel any masses or any tenderness. Okay, do you feel any tenderness? Okay, all right, so that looks good. Your hair is evenly distributed. Okay, we don't see any alopecia. It looks like everything's even, okay? All right, so now I'm going to look at your face, okay? We are looking for color. We're looking for rashes. We're looking for any masses, any tenderness, okay? So I see you have a little bit of acne lesions, okay? And now I'm going to go ahead and palpate your forehead, and we're checking your frontal sinuses. Any tenderness there?
No.
Okay. Your maxillary? Any tenderness?
No.
Okay. And then I'm going to check your temporal mandibular joint. Okay. Can you open and close your mouth for me? Okay. Move your jaw side to side. Good. I don't feel any clicks. Okay. And obviously she had no tenderness. Okay. Now I'm looking at your eyes. Okay. We're also looking for symmetry. Make sure your eyes look equal. Okay. And at your color of your eyes. Okay, at the sclera of your eye that is nice and white, no jaundice, no yellowing, discoloration noted. I'm going to look under your eye, your conjunctiva, which is nice and pink. We have no redness, we have no drainage, okay? Now we're going to go ahead and look at your eyes. Okay, I'm going to check for your pupillary response, okay? Alright, if you can go ahead and look straight ahead. And I'm looking at direct pupillary response and consensual, okay? Just look straight ahead. Okay? And consensual. Straight ahead, direct, and consensual. Very good. Now I'm going to go ahead and have you follow my finger, okay? Just follow my finger. Good. Okay, we just checked your cranial nerves 3, 4, and 6, okay? Now I'm going to have you close your eyes. All right, and tell me where you feel this, okay?
Forehead, left cheek, right cheek.
Good. We just checked your cranial nerve 5. Okay. Can you go ahead and frown for me? Close your eyes. Wrinkle your your forehead. Puff your face. Good. We just checked your cranial nerve 7. Okay. And everything looks intact. All right. I'm going to be looking at your... With the ophthalmoscope, we're going to be looking for your red reflex in your eye, so if you can look straight ahead. And we will check the right eye with the right eye. Once you locate the red reflex, you go ahead and move in and look at the inside of the eye. Okay. And we make sure that there's no hemorrhages and everything looks fine. Left side, I'm going to go ahead and support her head with my right hand. and check her eye. Look for the red reflex with my left eye as well. Once located, you move in and look at the back of her eye. Make sure that you can see the vessels and that there's no hemorrhage and everything looks fine. You wanna blink your eyes a little bit? Okay. Now we're gonna go ahead and move on over to your ears, okay? And we're gonna look at the auricle, your pinna, and make sure that it's nice and soft, that we don't feel any masses, that they're symmetrical, okay? We're looking at the outside. I don't see any drainage, all right? And I'm gonna be checking the inside of your ear, I'm sorry. Okay, and for an adult, we would check up and back, okay, and you go ahead and support, and you look for the tympanic membrane that's nice and white and pearly, no redness or any drainage. That looks fine. We would do the same for the other ear. Okay, tympanic membrane. Okay, nice and white and pearly, okay? For the pediatric patient, you would pull down and back. Okay. Okay, now I'm going to check your mouth, okay? Can you open your mouth for me? Say, ah. Okay, I'm looking at the tonsils. I'm looking at the back of the throat, the uvula. I don't see any masses. I'm looking at the soft palate, hard palate. Same, no masses, no swelling. At her mucous membranes, her teeth, we look for any cracks, no cavities. Can you lift up your tongue? And we're looking at her ducts. Okay, same thing, no swelling. Can you stick your tongue out for me? Move it side to side. Good. What is your name?
Victoria.
And can you swallow for me, Victoria? Okay, we've now assessed your cranial nerves 9 and 10 and 12. Okay, everything looks fine. Now we proceed to to inspecting her neck, to checking her neck. We go ahead and check for symmetry, for any masses, any swelling. I don't see any. We check, now we palpate, and we start by palpating the pre-auricular lymph nodes, post-auricular, submandibular, submantle, and her tonsillar. Okay, everything looks fine. Then you go down to the anterior cervical, okay, posterior cervical, and her occipital. Any pain?
No.
Okay. Then you check to make sure that her trachea is not deviated. You place your thumbs on each side, push a little bit back, and there's no tracheal deviation. I don't see any jugular distension. Okay, can you move your neck from side to side? And rotate it. Okay. Good. Can you shrug your shoulders for me? Okay. And we've now checked cranial nerve 11. Now we are going to go ahead and move down to the chest. And what we do is we inspect the chest. We look at the rhythm of her respirations, the rate. Everything looks symmetrical. We go ahead and palpate for any masses around the chest. Nothing. Okay, we do our affirmatives. Can you see 99?
99. 99.
Okay, and what we have is resonance would be our normal finding. Okay, any hyperresonance would be an indication of like emphysema. Then we start listening for breath sounds. And we start by on one side and you compare to the other side and move laterally. Can you take a deep breath? Again. Okay. Okay. Again. And again. Okay. Equal bilateral breath sounds. Okay, now we would move down to the back. Let me just turn to you. And in the back, we would do the same thing. We would start by inspecting, looking for symmetry, any masses or any lumps. We don't see anything. We would check for equal expansion of her lungs. Go ahead and take a deep breath. Okay, everything's normal there. We would go ahead and palpate the costovertebral angle. Any pain? Okay. And same thing with the premises. Can you say 99?
89. 99. 99. 99.
Okay. And what you do is compare one side to the other, so you move side to side. Okay, go ahead and turn around. Can you lay down for me, please? At this point, you would evaluate the breast. You would evaluate the breast by inspecting it first, looking for color, symmetry, looking at the areola, looking at the color as well, looking for any inverted nipples, retracted nipples, the skin texture, and to check for any nipple discharge. You would also do palpation of the breast in both men and female, and move in a circular motion and check for any nodules or any masses, and it would be done for both. So now we would do the heart, okay? And with the heart, you inspect and you check for your PMI, and it would in women it's a little harder to see because of the breast, but it's usually on the 5th intercostal midclavicular line. Then you would check for the precordium, okay, and you would palpate, okay, and that gives you like a position of where it's located. And you would auscultate for your heart sounds, and you would be looking for your S1, S2, and for any splitting sounds that you might hear, or any S3 or S4 heart sounds, okay? Okay, then you would hear for your aortic valve, your pulmonic, okay, your tricuspid, and your mitral, which is sometimes a little harder. Okay, at this time you would also check for jugular distension that would indicate maybe some fluid overload. You would check for pulses bilaterally, your radial, your pedal pulses, your cap refill, which would be less than 3, okay, and yours is, your color, you're not cyanotic, which indicates good cardiovascular return, okay? At this time, you go ahead and assess the abdomen, okay? We start by inspecting the abdomen, divided in 4 quadrants, right upper, right lower, left upper, and left lower quadrants, okay? We go ahead and auscultate the abdomen for bowel sounds. Okay. You have very hyperactive bowel sounds, but if we weren't to hear bowel sounds, we have to allow ourselves up to 5 minutes, okay? then we would go ahead and palpate the abdomen. And prior to palpating your abdomen, we go ahead and have the patient empty their bladder. Otherwise, it's very uncomfortable. Did you empty your bladder?
Yeah.
Okay. So I'm going to go ahead and touch you. You're going to feel my hands, okay? So any pain here?
No.
Any pain here?
No.
Here?
No.
And here?
No.
Okay, and what we're feeling for is for any masses, any tenderness, and then we would proceed to palpate the liver. And we're looking for it not to be enlarged, okay? Take a deep breath. That makes it usually easier. Okay, and then you can do the same trying to palpate the spleen. Okay, again. Okay, which is a little bit harder to palpate when it's not enlarged. So it's good. Okay, at this point, you would move down to the genitalia. Females would have pelvic exams. We would inspect the outside of the vagina, the labia, for any discolorations, any drainage, any lumps. Then a speculum exam would be done. Same would be done for the cervix. We would visualize the cervix and also check for that. Okay. Males would have the penis inspected. Any drainage or discoloration or any lumps or bumps would be noted on them too. Okay. So while you're laying down, I'm gonna have you flex your legs. Good. Straighten them out. Okay. Can you open your legs? Okay. So we have adduction. Can you close them? Adduction. Okay. Can you sit up for me? On this side. Okay. And we're gonna check for your reflexes. Okay. We would do brachial. Okay. Radial. Go ahead and relax your arm. Okay. Okay. And then patellar. Okay. Then we would do the Achilles. Good. I'm going to do this test, the hearing test. Okay. Very important that you tell me. We're going to do the Weber test. And that you tell me if you hear it, which side you hear it on, okay? Both. Okay. Now I'm going to do it one more time, and we're going to put it on your bone, on your mastoid bone, and you tell me when you don't hear it anymore, okay? Okay. Okay. And now I am going to whisper a word. And I want you to tell me what I said, okay?
Apple.
Orange. Good. So your hearing is intact. Can you go ahead and stand up for me? Go ahead and bend down. We will check her back. Make sure that her spine is nice and symmetrical. Hips are symmetrical and aligned. Okay? Go ahead and stand on one leg. Close your eyes. We're checking for balance, equilibrium. The other one. Good. And can you put one foot in front of the other? Good. And that concludes my physical assessment. Thank you very much, Victoria, for being my patient. How long was it?
19.